I'm Jennifer Buczyner. I'm a general neurologist practicing in the Palm Beach Gardens area. Just to give you my background, I actually did a neuromuscular fellowship and neurophysiology fellowship at Emory, where I trained with some of the premier neuromuscular specialists in the country, including today we're talking about Myasthenia Gravis and Michael Benatar, who I think his name comes up in one of the papers that I'm going to show you briefly. You have what we call a neuromuscular junction in your body, and this is kind of where the nerve gets the signals to tell the muscles to move. So on the left side of the picture, you see what we call an axon, which is a nerve axon. And at the bottom, you see the muscle. So in a normal muscle, what happens is there is a chemical signal that is propagated throughout the axon and ends up getting to the nerve terminal where a chemical called acetylcholine is released. And that chemical then tells the muscle what to do to move. So in myasthenia gravis, which we're going to talk about on the right side, what happens is there's destruction of that chemical called acetylcholine, and that is due to multiple factors, which we'll go through, but one of the most common being an antibody to the receptor where we process acetylcholine. So whenever I see somebody, I don't care who it is and who diagnosed them, the first thing I usually ask them is when the diagnosis was made and how it was made. And one, you learn a whole lot from that, and two, it's really interesting, and sometimes you may not always agree with the diagnosis and how they got to that diagnosis. If you get on good treatment and if you have a doctor who's kind of helping guide the ship, you can do really well with this diagnosis. And this is Lorraine.
Lorraine, she's had myasthenia for how many years?
Since 2009.
2009. Tell me what symptoms you had when it started.
Before I was diagnosed in 2009, in 2007 and 8, I was always vertigo. Okay, so I don't know. I was always walking to my left.
Were you having double vision?
Mm-hmm.
Okay.
And felt like I wanted to fall. And I was always having problems breathing. Seemed like my lungs were not expanding.
Okay.
And I went to all these different doctors. They thought I had lupus.
Got it.
They tested me for rheumatoid arthritis. And at one point I went to therapy, and I continued the therapy because I thought I was losing my mind. And one particular day, I was trying to eat, and the fork fell out of my hand. I couldn't grip it. I couldn't pick it back up.
Why did they tell you there was nothing more you could do?
I don't know. Someone told me, say, now, go see a neurologist. So when they started testing me for that, they said, you had myasthenia gravis. And I go, well, what is myasthenia gravis? And in between all that, I had problems swallowing.
Yeah.
Okay. And I just couldn't hold spit.
Yeah.
I was always drooling. And
how many times have you been hospitalized for your myasthenia?
I say maybe about 6 times.
Tell me what you've been doing most recently to treat your myasthenia.
What have I been doing?
Yeah.
To maintain myasthenia? I pray a lot. But
what about your medicine?
At times, I take more of the medicine. We tried medicine, Imaron.
Didn't work.
It didn't work.
Prednisone.
Cerecep didn't work, and I have to fight the insurance on Cerecep because they said that it was a no-nonsense drug for what I had. In other words,
Prednisone.
Prednisone seems to have made me worse. The weakness.
IVIG.
IVIG worked for a while, but then only for maybe about, maybe about 6 years.
And how about plasma exchange? Plasma exchange.
Plasma exchange, I find that to be good, but it's really, it limits me to everything. I can't travel as far, I can't do, because I'm always in for treatment, I can't.
How do you feel now about starting it?
I feel great because then I met you, and you specialize in myasthenia gravis. There are 2 people in the state of Florida Like I said, there was one in Sarasota, and I forget where the other guy was. He
Miami.
was up,
The guy in Miami, Michael Benatar. Yeah.
And I said, well, I spend too much time in my car, trying to get to these places.
And you take care of your twins, right? Of your grandkids.
Yeah, well, yes. And then at first, when they were born, they were so small, I had to be careful how I picked them up because I had so much weakness. I always had to have somebody in the house with me, with them. And feeding and holding them. Church members would come by and make sure, that they were fed and changed, and me and my husband.
Yeah. So if this medicine works for you, what are you most excited to do with it?
What I want to do?
Yeah.
I want to swim.
Make sure that you have an experienced neuromuscular specialist or neurologist who is familiar with treating MG. Like I said, this is an extremely rare disease. Some people, for whatever reason, it's just not their area and maybe not something they're comfortable with. And myasthenics can get very sick and can be, hard to take care of. So make sure whoever you're seeing is comfortable with it and comfortable managing it, because it's important that you have that relationship and they know when to kind of pull the trigger and when to be available to you. Make sure that you work closely with your primary care clinician as well. It's important that you follow with them for lab testing and follow-up results. It's important that you also stay active, but don't overdo it. And then anytime you have an infection, infections in any condition in neurology can always make any neurologic diagnosis worse and can cause an exacerbation. So it's important that you kind of stay on top of that.